years, I continuously feel pain at my right side. I hear a lot about hepatitis and that hepatitis is killing people. I was afraid to go to any hospital because the fear and the thought drained me. But when my eyes stayed yellow and I couldn't take the pain, my friends took me to Dr. Marina's clinic. To my surprise, it was a gallstone in my liver. Just few medicine, herbal tea, serious diet, and only 2 months. I wasted time and nearly died. Thank you, doctors from Diamond Hospital, for saving my life. Trust me, she's just the best.
Hello viewers. Today we are continue our cycle of the programs about the disease which is unusually and which is not be detected in our usual life. We are going to discuss today about the kidney injury. We can have and hear about injuries when we are falling down, has lorry accident, when we scratch and hit our body, we have injuries. And we never hear that injury can have a kidney. And which condition can give that injury, how it can be managed, and how it can be cured, and what is caused it, and all another questions we are giving to our specialist, Dr. Joshua Asante, who is an MPhil on the pharmacology, and he is a specialist on the kidney injury, and he gives scientific job about the investigation, how all this answer will come to us, and he will share how it can be detected and how it can be cured. Welcome and stay with us.
After 2 miscarriages, I was diagnosed of urinary fibroid. I was so scared after several doctors offered me surgery because that's the only solution to my problem. A friend of mine had 2 surgeries, but the fibroid grew again. I just visited Dr. Marina's clinic and I successfully conceived after she treated me with her natural herbs without surgery. And now I am so happy with the baby. My sisters, at Dr. Marina's clinic, her medicine really works.
We hear about type of injuries when we are falling down, and now we hear it is like a new term for our viewers, that kidney injury. What is caused the kidney injury and how it is created?
When we say kidney injury, this is a pathological condition which happens to the kidney within a short period of time that we usually refer to as acute kidney injury. Most often, the major cause of this kidney injury is based on the medications that we use, the antibiotics that we use, and especially the painkillers or the pain relievers. Mostly, when people complain of pain, either headache, waist pain, or the knee pain,
And they are straight go into the pharmacy
to buy medicine.
Painkillers, and they are straight going to ask what they are giving them. Number 1, paracetamol.
That is it.
To dissolve everything, number 1 solution, it is a paracetamol.
Very good.
The second, they are giving them the diclofenac.
This is correct.
The third one, it is ibuprofen. Then they are giving what additionally?
Naproxen.
Naproxen. It is this is a naproxen. I keep quiet because it is give more problems than even paracetamol.
Okay.
This is that, but we talk today about the injuries.
Yes.
And plus you mentioned about the antibiotics.
Yes.
But we are giving antibiotics not only to the adult people. We are giving antibiotics anytime. You have flu, antibiotics. If you have some of the cough, it is antibiotics. If you have any of the pain, it is just antibiotics. If you visit the doctor, what they are giving to our children first, it is antibiotics.
Yes.
It means we start to have kidney injury from childhood.
Yes.
And nobody detected.
Yes.
But finally, if it is from childhood is not detected, and the child is grow and kidney acute injury is already there,
Yes.
and it is coming to the chronic disease
Yes.
and start affecting the kidney.
Yes.
And how it is just creating, because how the kidney affect, what is happening, what is the symptoms when the people supposed to feel pain or something, because they are going to collect medicine to relieve pain, and they create another pain.
Yes. To understand the cause of this condition, we must first understand the major work of the kidney. The kidney helps to eliminate unwanted substances from the body. So the medicines that we take orally, the injections that we take, the final stage is the kidney. So the kidney, it is possible that every agent that we take,
Like metabolite to take out.
yes, to take out will have an effect on the kidney. Mostly, we are using strong antibiotics like gentamicin. And from our research, it was detected that the continuous use, and it is common in our setting, in the tropical region, that patients are given a lot of gentamicin. But the side effect or the later problem which will be developed is this kidney injury. And we cannot avoid antibiotics because
So
when
it
you
is,
have,
it is a part of our life
Yes,
now.
it is.
Bacteria around, and it is necessary to take.
yes,
If you have typhoid, if you have any stomach problems,
Yes.
we just immediately start take antibiotics to treat typhoid.
yes,
And it means if we take the antibiotics, we are affected our kidney.
good.
And we are surprised, and what we should do, give us the solution.
Yes. So in this situation, it means you cannot avoid kidney injury because the possible causes are things that you cannot avoid. Kidney injury can also result from the diet or what we eat, and you can't stop eating. You can't stop taking antibiotics. You cannot stop taking painkillers, and therefore you need something to protect the kidney. And also, if the injury is coming or developing,
If it
you
is already
need-
there.
if it is already there, you need an agent to protect the kidney and to cure the kidney. This was the scope of our research, that we came out with the herbal combination first to protect the kidney. This is nephroprotective effect, and then to cure. This is the nephrocurative effect. And we also initially examined this product in a way that we did toxicity, that this combination of the herbs does not have any effect on the internal organ, especially the kidney.
No any adverse effect.
No adverse effect.
That it is not affected in other organs,
It is safe
like
for use.
liver, like additional injuries and the same problems to the kidney.
kidney.
It means you study all the
All
points
this.
that toxicity is
Yes.
absent.
Yes.
It is
we-
not present and it
It
is
is
not
not,
affected.
yes, that it
Okay.
is very safe for use.
It means you find the solution.
We find the solution.
Okay, the grace of God.
Some time back, I had fertility problems. I experienced a number of miscarriages. Due to that, I had to visit the hospital. I was told I had fibroid. I visited several hospitals but never had a solution to my problem. One day I was watching the telly. I saw Dr. Marina's program on the TV. I picked a number and I called. I visited her, and honestly, she cured my fibroid without operating on me. 2 to 3 months later, I discovered I was pregnant. And thank God, today I also have a very beautiful baby girl.
We thank God. Then you mentioned about the symptoms, what will show if you have the kidney injury. We have to know the location. We have the 2 kidney, one on the right, and then we have one on the left side, just going closer to the ribs. And then we've talked about the function of the kidney, that it helps to eliminate yes, and then waste. You can have pain radiating on
To the back.
to the back.
We take, viewers, we take your attention that the symptoms, what you can just start feel if you take some of the medicine, if you take some of the drinks, if you take some of the food, and after that you start feel back pain, just at the back here or maybe at the back here, we take your attention that it is possible that it is a kidney injury developed from the food or from medication, you need to take your attention. Then additionally, apart of the pain,
Apart from the pain, you can also have chronic waist pain,
waist pain.
especially for the men. And the kidney, one major function is to produce quality blood, like hemoglobin, to make our blood stay quality. If the injury is coming into the kidney, it is not able to perform this function and can make you feel weak
Okay.
and tired.
And if you feel weak, that they are telling like you have short of blood.
You have short of blood.
It means
What is
your
the cause?
HB, it is coming down because kidney doesn't produce erythrocytes, the red cells.
Yes.
And we're supposed to take attention for it if you start feel weakness, if you feel dizzy, if you feel like always want to sleep, and you want to just relax anytime when you sit, you want to lie down and
Yes.
sleep, you take attention that maybe you have short of blood, like result of
Of the
kidney
kidney
injury.
because it is not able to produce the hormone erythropoietin to produce erythrocytes.
Well, now
for
you are telling
hemoglobin.
scientific things that viewers don't understand. New
Okay.
term like erythropoietin
Yes,
coming.
and especially in the men, this is very critical. You see, for the females, the blood level can come down because of the menses. But if you are the man, you go to the hospital and you are examined, and then you are told that your hemoglobin level or your blood quality is coming down. This can be as a result of kidney injury, that you have to pay particular attention, and then you come to our center for us to detect, because early detection is very important. From our research, when you start using our product early, you get results faster. So we advise our viewers, if you have a friend, if you have a family member who has these symptoms that we have mentioned,
That the dizziness, let's mention it again for
Yes.
the viewers, that if you feel dizzy, if you feel that back pain, if you start feel like urination,
difficulty in urination,
difficulty,
or
painful,
urination, swelling of the
Swelling
legs
of the
after
legs.
long sitting.
maybe swelling of the hands, maybe swelling of the face. If you wake up in the morning and you feel like your blood, the body starts puffy. Maybe periodically you feel like you feel chill and like shaking or some of the discomfort, but the temperature is normal,
Normal.
but the BP is normal,
normal.
everything is normal, but you feel some of the discomfort that you understand something going on. Need to take attention and come to our facility that we will just detect what is going on. Maybe if you have that kidney injury and you know that previously you take antibiotics, that you need to come to our facility to check and detect about that kidney injury. But if you don't detect it in time, what happened?
When you don't detect it in time, it is going into chronic condition. And it will take a very long time for the treatment. And then it is giving a whole lot of other conditions. When you have chronic kidney disease, it can cause the kidney failure.
Wow. It is when the people stay on the dialysis.
On the dialysis.
And it is
means-
just forever?
Yes, if you
Or
don't
we-
do
or
the
we- or we-
dialysis,
or
it
we have
means
solution.
the solution is you have to come. That we will start giving you the product. If the kidneys they don't collapse at all, we can revive. Even if you're on the dialysis, we can revive.
It
the
is
kidney.
possible.
It is possible with the product.
That please we take attention the people. If you have any of your family member or you are personally stay under the dialysis and they are telling that you have a kidney failure, that your kidney is not collapsed complete and they are not telling that necessary to make transplantation of the kidney, you have additional kidney which is healthy because 2 kidney couldn't be transplanted at once. We advise you come to our place that we just give you the medication which can be revive the healthy, the affected kidney. It will take long period of time. How long it will take? What is in your practice? What is
Usually, patients who have the kidney failure and are on the dialysis, maximally 8 months, 1 year. But people who have the acute, or we are detecting it earlier, within a month or two, because with the research, we induced kidney injury in the lab, and then after giving the product, after 7 days, we had the results, 14 days. The results that we had is like the medicine or the product is washing the kidney of all the injuries, all
from the toxins.
Yes, from the toxins and everything, and making it fresh. This is on the acute stage. But when it is
Just during 1 month.
during 1 month,
Wow.
you have
Wow, this is a fantastic.
yes, you have positive results.
Because how we hear like all the official publicity saying that no solution for the kidney failure.
This is
Only one way, surgery and transplantation.
Yes.
Dialysis and transplantation. But how I understand that the dialysis, which is just replacement of the kidney function.
This is it, because we have patients who were on dialysis, like in a week they are supposed to go like 3-4 times in a week. But when we started giving them the product, the duration or the frequency for the dialysis was reduced. Like if they are going 3, 4, 5 times in a week, now they are going like twice or once a week. And the creatinine level is not going so high like how it used to be. It means there is hope. Yes, it means that there is hope that the kidney cells are reviving and this patient can have cure.
It means we are giving now, with your discussion, we are giving hope to the people who has a kidney failure,
Yes.
who has a kidney injury,
Yes.
that if you are under dialysis and you are going to dialysis 3 times in a week, together with our medication, we can reduce the number of the dialysis. Not immediately, because reviving it will take time, like 1 month, 2 months, 3 months. If it is just only detected today, just a short period of time you stay under dialysis, it will be shorter period to revive. But if you are under dialysis 2 years, 3 years, it will take longer period, because kidney itself, it means has a damage, and the dialysis, it is just going to replace the function.
Yes.
That a lot of cells inside in the kidney,
Yes, it does
the
also.
tubulars,
Yes.
the nephrons, it has the damages,
Yeah.
has the injuries, some of the deformations, and take time before it will be renewed and regenerate again.
Yes. This product is so powerful. And
This
it
is
natural.
we see it,
Natural combination,
we just
which
see
is
it.
registered and approved by the FDA, that it is preventive. That is my concern, because things that will cause kidney injury we cannot avoid, like the smoke from cars, the
Which is not, we couldn't stop, because this is our environment.
infections. We live in a community full of infections, which is unavoidable, and therefore we need to protect our kidneys. So we even calling people who do not have kidney injury, people who do not even have kidney disease, that they say tea. You wake up in the morning and you prepare this tea, and then you take it to prevent and protect your
Just during the day.
just during the day. you
No,
can
this
prepare.
is like from the beginning we advise our patients
Yes.
that you can just buy our container of the tea and use it during 1 month to prevent your kidney disease.
Yes.
Then the next month you can take the tea which can be just prevent and protect liver disease.
That is it.
Because we are eating a lot of pepper, we are eating a lot of oil.
Yes.
That preventive way, it is very important, because no any chemicals and pharmaceutical product for prevention of kidney disease. We have a natural remedy, and Dr. Joshua Asante, he just makes scientific investigation about it, and he is a specialist on the kidney disease. He just explained to us about that kidney injury, how it can be revived again, that we have remedy, we have a solution. Don't sit at home. You need to come to our place. If you are so far, you can just go to our website www.diamedghana.com, or contact to the numbers which you can see on the screen, and we are just together with our team will help you to regenerate your kidney or to prevent your kidney disease. And if you know in your history that you was under antibiotic therapy, we just advise you once in a month, take our product and just wash your kidney to regenerate the structure again. Welcome to our place. Today we are so happy that we have a solution for the kidney problems, and we are with you. Continue, stay with us, that we will explain the next points how can be cure and protect another diseases.